If your blood pressure looks high at the doctor's office, then looks normal at home, or seems to change for no clear reason, there's one thing you need to understand before you trust that number. A blood pressure reading is not the same thing as your real blood pressure. And for adults over 60, that difference can lead to anxiety, overtreatment, undertreatment, or years of confusion. Subscribe now for research-backed senior health guidance, because one better question at your next appointment could protect your heart tomorrow. I'm Dr. Emma Carter, and today we're talking about the hidden reason so many people are making decisions about their health based on numbers that may not be telling the truth. The big idea is simple, but incredibly important. A single blood pressure reading is only trustworthy if it was taken correctly, interpreted correctly, and confirmed correctly. If any one of those steps goes wrong, the number on that screen can look official while still being misleading. And that matters because blood pressure is one of the most common reasons older adults are prescribed medication, have doses adjusted, or are told they're doing fine when they may not be. A lot of people think blood pressure is like stepping on a scale. You get a number, and that number is reality. But blood pressure does not work that way. It changes minute to minute, posture to posture, and stress response to stress response. So when I say, don't trust your blood pressure until you know this, here's what I mean. Do not trust one rushed reading taken while you're talking. Your feet are dangling, your bladder is full, your cuff is the wrong size, and you just walked in from the parking lot carrying your purse and your stress with you. That is not your true baseline. That is a snapshot of your body reacting to the moment. And too many people are being judged by that moment. Some are told their pressure is uncontrolled when it isn't. Others are reassured because one number looked decent, even though their readings at home or across time tell a different story. Let me explain why this becomes even more important after 60. As we get older, blood vessels naturally become stiffer. That means the top number, your systolic pressure, often becomes more sensitive to stress, movement, caffeine, poor sleep, and even the way your body is positioned in a chair. So if you are 66, 72, 78, and you've ever thought, why does my pressure seem all over the place? The answer may not be that your body is failing you. It may be that the number is being captured under conditions that exaggerate what is really going on. And once a misleading number enters your chart, it has a way of following you from visit to visit like it's a fact. This is where people get trapped by what I call the authority of the machine. The cuff tightens, the device beeps, the numbers appear, and it feels medical, precise, settled. But blood pressure measurement is only precise when the setup is precise. If the setup is sloppy, the number can be sloppy too. And the frustrating part is that the number still looks exact. It still says 148 over 86 or 132 over 78, as if it were measured under laboratory conditions. But it often was not. In real life, people are measured while chatting, crossing their legs, scrolling their phone, sitting on exam tables without back support, or using cuffs that do not actually fit their arms. And that brings us to the thing I wish far more adults understood. Technique changes blood pressure more than most people realize, not by 1 or 2 points, sometimes by enough to completely change whether a reading looks normal, elevated, or frankly hypertensive. If your arm hangs below heart level, the reading can look higher than it should. If your back is unsupported or your feet are not flat, it can climb. If you're talking during the reading, it can rise. If your bladder is full, yes, even that can push the number up. That means many bad readings are not necessarily telling you your arteries are in crisis. They may be telling you the conditions were wrong. Now let's talk about one of the biggest mistakes of all, because this one shocks people. Cuff size. If the cuff is too small for your arm, your reading can come back falsely high. And not just a little high, in some people, dramatically high. That means you can sit there calmly, do everything right, and still get a number that suggests your blood pressure is worse than it really is simply because the cuff should have been larger. On the other hand, if the cuff is too large, the reading can come back too low. So when patients tell me, my numbers make no sense, one of the first things I wonder is not just what the pressure was, but how exactly it was measured and whether the cuff actually fit. This is especially relevant for seniors because arm size changes over time. Some people lose muscle. Some gain weight around the upper arm. Some have arthritis that makes positioning harder. Some buy whatever blood pressure monitor is on sale without ever checking whether the cuff matches their arm circumference. And then they spend months chasing numbers that were distorted from the beginning. That can lead to medication increases, dizziness, fatigue, falls, and a constant feeling that your body is doing something mysterious. But sometimes the mystery is not your heart. It is the measurement. Once you see that, the whole conversation changes from what's wrong with me to can we make sure we are measuring this correctly first? There is another reason not to panic over one office reading, and it has a name you've probably heard before: white coat hypertension. That is when your blood pressure rises in the clinic but is normal outside the clinic. Some people's nervous systems react the moment they sit in a medical setting. They may feel fine walking in, then see the cuff and their heart rate jumps. That does not mean they are imagining it. It means the body's stress response is real. And if treatment decisions are made from that office reading alone, there is a real risk of overtreating a person whose everyday blood pressure may actually be acceptable. For older adults, overtreatment is not a small issue. It can mean weakness, lightheadedness, balance problems, and falls. But the opposite problem matters too, and this one gets less attention. Some people have normal readings in the clinic and higher readings at home. That is often called masked hypertension. These are the people who are told everything looks fine, then go home and live with morning surges, evening elevations, poor sleep, stress, or higher readings that no one sees because they only show up in real life. So a single office reading can mislead in both directions. It can make a healthy pattern look dangerous, or a dangerous pattern look harmless. That is why truly understanding blood pressure means looking beyond one performance in one room on one day. Your pattern matters far more than your snapshot. And I want to slow down here because this point could change the way you approach every appointment from now on. Your blood pressure is not one number. It is a pattern across time, conditions, and settings. Morning versus evening. Before medication versus after medication. Rested versus rushed. Home versus clinic. Calm versus anxious. Once you understand that, you stop being emotionally controlled by every isolated reading. A lot of adults over 60 see one high number and immediately spiral. Is this a stroke coming? Is my medication failing? Am I getting worse? Sometimes that number deserves urgent attention, absolutely. But many times, it deserves context before it deserves panic. And context is what turns blood pressure management into something rational instead of frightening. So what does a trustworthy reading actually look like? It starts before the cuff even goes on. No smoking, no caffeine, and no exercise for about 30 minutes before the reading. Empty your bladder. Sit quietly for at least 5 minutes. Put both feet flat on the floor. Keep your back supported. Rest your arm on a surface so the cuff sits at heart level. Use a bare arm, not a sleeve underneath the cuff. Stay silent during the reading. Then take 2 readings, 1 minute apart, and record both. That may sound fussy, but this is exactly the point. If you want a trustworthy number, you need a trustworthy process. We should not demand certainty from a measurement taken carelessly. And if you monitor at home, please hear this part. Not all home machines are equally reliable. A monitor being easy to buy does not automatically mean it has been shown to measure blood pressure accurately. Wrist monitors are tempting because they feel convenient, but they are generally less dependable than a validated upper arm monitor. And even a good monitor becomes a bad tool if the cuff is the wrong size or the device is used incorrectly. So if you already own one, bring it to your next appointment. Have it checked against the office equipment. Ask whether the cuff fits your arm correctly. Ask whether your technique looks right. A 10-minute review of your device can prevent years of bad assumptions. Now let's talk about why all this matters beyond numbers. Because blood pressure treatment decisions affect how people feel every day. If your readings are being overestimated, you may be placed on more medication than you truly need. Then come the symptoms: fatigue, dizziness when standing, brain fog, reduced exercise tolerance. That half step behind yourself feeling so many older adults describe but struggle to explain. And because those symptoms build slowly, people often blame age. They think, well, maybe this is just what 74 feels like. Not necessarily. Sometimes what 74 feels like is the downstream effect of treatment based on readings that were never properly confirmed. And that is why accuracy is not a technical detail. It is quality of life. Here's a scenario I see all the time. A patient gets a high reading in clinic after traffic, poor sleep, and a stressful morning. Medication is increased. At home, they start feeling washed out. They get up from a chair and feel unsteady. They stop walking as much because they are tired. Their confidence drops. Meanwhile, the chart shows improved blood pressure control, so everyone assumes things are going well. But the patient feels worse, not better. That disconnect should always make us pause. Because blood pressure control is not just about forcing numbers downward. It is about reducing risk without damaging day-to-day function. And you cannot do that well if the measurement itself has not earned your trust. There is also an emotional side to this that no one talks about enough. A misleading blood pressure number can train you to live in fear of your own body. Some people start checking compulsively. Others avoid checking because the result stresses them out. Some sit at the kitchen table holding their breath, convinced every reading is a verdict. But blood pressure is a biologic signal, not a moral report card. It does not mean you failed because one reading was high. It does not mean you are safe forever because one reading was low. It means your cardiovascular system is responding to a mix of physiology and environment in real time. And if we want the truth, we have to create conditions where the truth has a chance to appear. This is why current medical thinking has moved more and more toward confirming high blood pressure outside the clinic, not just inside it. Home readings and, in some cases, 24-hour ambulatory monitoring often give a much more realistic picture of what your blood pressure is doing in ordinary life. That matters because your ordinary life is where risk lives, not just in the exam room. If your pressure is consistently elevated when you wake up, during your day, or in the evening, that matters. If it only spikes in the clinic, that matters too. Those are different situations, and they should not be managed as if they are identical. The more we personalize the measurement, the more intelligently we can personalize the treatment. So here is what I want you to do before your next appointment. First, stop treating a single reading like a final verdict. Second, if you monitor at home, make sure you are using an upper arm device with the right cuff size. Third, take your blood pressure under consistent conditions. Same chair, same arm, same general times of day. Fourth, write down your readings instead of relying on memory. And fifth, if your office readings and home readings do not match, say that clearly. Do not minimize it. Do not assume the office number automatically wins because it was taken in a medical building. Sometimes the most clinically useful information in the room is the pattern you brought from home, not the rushed number printed at check-in. You should also know when not to simply shrug off a reading. If your blood pressure is extremely high, especially above 180/120, and you have symptoms like chest pain, shortness of breath, weakness, vision changes, severe headache, or trouble speaking, that is not a wait-and-see situation. That needs urgent medical attention. And if you get a very high reading without symptoms, it should still be repeated after a brief rest and discussed promptly. So I am not telling you to ignore blood pressure. I am telling you not to surrender your judgment to a number that may have been gathered badly. There is a difference between respecting the data and blindly obeying it. If you remember only one sentence from this entire video, let it be this: the number is only as good as the method. That is the thing you need to know before you trust your blood pressure. Not whether the machine looked official, not whether the nurse seemed busy, not whether the printout looked precise. The method is what gives the number meaning. And once you understand that, you become a much better advocate for yourself. You start asking better questions. Was I rested? Was I seated properly? Was the cuff right for my arm? Was this confirmed outside the clinic? Was this one reading or part of a pattern? Those questions can protect you from years of unnecessary confusion. And for adults over 60, that matters enormously. Because at this stage of life, we are not just trying to chase perfect-looking numbers. We are trying to protect the brain, the heart, the kidneys, the balance, the energy, the independence, the ability to walk confidently across a room and wake up feeling steady. Blood pressure management should support those things, not accidentally chip away at them. So if your numbers have felt inconsistent, if your treatment does not match how you feel, or if you have been making health decisions based on one reading at a time, this is your sign to slow down and look more carefully at the process itself. Sometimes the smartest next step is not a stronger medication. It is a better measurement. So the next time the cuff tightens around your arm and a number flashes onto the screen, pause before you believe it. Ask what conditions produced it. Ask whether it fits your broader pattern. Ask whether it deserves confirmation before it changes your treatment. That one habit can make you calmer, more informed, and much harder to mislead. If this helped you, comment "pattern not snapshot" below so I know you watched to the end. And tell me, do your home readings usually run higher, lower, or about the same as the doctor's office? I read those comments carefully. I'm Dr. Emma Carter. If you haven't subscribed yet, do that now, and I'll see you in the next one. Take very good care of yourself.